Next topic we're going to touch on is Social Security. So, Social Security is a social insurance entitlement program established in 1935, predated by CSRS. So, part of the reason why CSRS employees weren't in Social Security. In 1935, though, the average life expectancy was less than 62 years. So, if you think it through this, um, when they designed it to not pay out for most people because that was the earliest qualification date then as well. And so what happened is medical advances, technology, things like that. Um, we're living a lot longer today than we did back then. Today, the average life expectancy of a male is actually 82 and a female is 84, so quite a bit further down. So, but Social Security really hasn't been revised since that 1935 time period. So when it was created, there was four parts to it: retirement, disability, health, and survivor benefits. Now, we encourage you to go to ssa.gov if you've never been to that site before. When you go out there, you can create your own profile and view your benefits projections. A lot of you might remember they used to mail us these projections. And when you get close to Social Security age, they do start mailing them again, but they don't mail them like they used to. So the reason is they spent a bunch of money and they created a great website. It's a very um, informative site. It's not overly complicated to use once you get registered. Getting in can be a little tricky, but once you're in, again, you can see your benefits, print out your summary report. It'll show you age 62, 63, 64. I mean, it gives you all the different variety payout options for whenever you might want to retire. Now, we mentioned earlier that you contribute 6.2% out of your pay. However, that is up, that is, it has an annual cap. So for 2024, that annual earnings cap is 168,600. So you pay 6.2% on the first $168,600 of earnings. And then after that, you do not. Um, in addition to it, you also pay a Medicare payroll tax of 1.45 or 2.35% of your total base pay. So it's important to note that there is a cap on how much does come out of your check. Now, to qualify for benefits, you do have to have what they call 40 credits of time earned. However, don't confuse that with 40 years. You can earn up to 4 credits per year of full-time work. So 40 credits can be acquired in a 10-year period of time of full-time work. Now, when they go to calculate your Social Security benefit, there is a couple of things that they do. So the first one is they calculate what's called your AMI, or your average index monthly earnings. And so what they do here is they're going to take your earnings history and they're going to inflate every year of earnings you have um, up to kind of a present value. So your earlier career payments are going to be adjusted for inflation. So you kind of have all these earnings years on a level playing field. Once they do that, they're going to take the highest 35 of those years and they're going to basically average them together to make up your AMI calculation. And there's another slide on how they average it, but that's what they're going to do. And then you can also there's estimators on that SSA website. Now it's important to keep in mind that they are using 35 years, so you may have a 40-year or longer work history, but again they're going to take the highest 35. Now if you don't have um, that long of a history, uh, there may be some zeros in that calculation, so it's important to keep that in mind. Each year you're working um, in the latter part of your career, in theory, you're probably replacing one of those really early years where you were maybe a teenager working your first job in maybe the grocery store or something like that. Um, that does replace that, or maybe even replacing a zero. So some those years till you get kind of 35 good solid years of earnings. Each year you're adding a pretty nice federal employee earnings year is replacing one of those really low ones. Now your AMI has what's called bend points. And so they use these bend points to calculate what's called your primary insurance amount or your PIA. Now, your PIA, again, they use these acronyms and fancy words, but that's essentially your full age Social Security benefit. And so the way they calculate it um, and this is using 2020 numbers. These do adjust a little bit every year, but just sort of an example is how it's calculated. So off that Amy number that you had, right, they're going to give you 90% of the first $960. And then from $961 to 5,785, they're going to give you 32% of that number. And then any amount over $5,785, they're going to give you 15% of that number. So that's how they kind of calculate up what your actual Social Security benefit is. Now, I mentioned that it's your full retirement age Social Security is 100% of that PIA number. However, as we talked about earlier, you can take Social Security as early as age 62. If you do that, you do receive a reduced benefit. And so what you'll see here is you'll get about a 30% reduction, or you'll get about 70% of what that PIA number is, roughly. Um, you also can go longer or delay taking your Social Security past your full Social Security age, and they actually allow you to defer it up to age 70. And if you do so, they're going to give you 8% uh, added to your benefit per year over that full retirement age. So let's say your full retirement age is 67, you delay taking it to age 70. So it's a 3 year delay. You'll get 8% for each year. So 8 times 3 is 24% increase in that Social Security benefit payout. Now, please don't misunderstand. I am not telling everyone on here that you should delay your Social Security to age 70. Every one of you's situation is different. And there is a lot of value in sitting down and really trying to figure out what's the best way to maximize your Social Security benefit. Things that go into this is, are you married or single? What is your family history from a life expectancy standpoint? Are you healthy? Things like that go into play to determine, should I take it at 62? Should I take it at 67? Should I take it at 70? Right? There isn't one kind of set answer. Each person's a little bit different, or each situation's a little bit different. Definitely advise, suggest you talk with us, talk with your financial planner if you have one, and really kind of work through maximizing that, because you can cost yourself thousands of dollars, in some cases hundreds of thousands of dollars, by mistiming this benefit. So your full retirement age is kind of based on your year of birth. So if you are 1937 or earlier, your full retirement age is 65. But on the other end of the spectrum down here, if you're 1960 or later, your full retirement age is 67. And so it does vary in between. So find your year of birth there. There is a pretty big chunk right here from 43 to 54 that all were at 66. So figure out which year you are. That's your full retirement age. You'll hear that reference twice, once in reference to Social Security, and we'll touch on it again in the TSP section, as to how they calculate your L share that they put you in automatically. So just keep that in mind, that this is your full Social Security age. All that means is that you'll get your 100% of your PIA. The other thing that it means when it comes to Social Security is that if you continue to work past that date, but do elect to turn on your benefit, there's no reduction in your benefit because you're still working. If you turn on your benefit before that full age, then there is going to be a reduction in your benefit if you exceed the annual earnings limit. The annual earnings limit is adjusted every year. For this year, it's just for 2024, it's a little over 22,000 is what they let you earn. And if you go over that number, then you do start to reduce your benefit. So Social Security retirement benefits for a spouse, right? You have two options as a spouse. You get the higher of your own benefit calculation, or 50% of your spouse's PIA number. And so you want to look at that if you were, let's say, for example, the spouse is a homemaker, or maybe, worked part-time while raising kids or something like that. Well, there's a chance that their Social Security benefit may be significantly less than their spouses, their federal employee spouses. And so that's why they give you this option. They recognize that that's still like working, and that you deserve to be rewarded for that. So you do have this option. And Social Security will calculate it for you, tell you which one's higher. But You can also work with your planner. It certainly should be part of your financial plan to kind of estimate out which option's best for you. Now, spouses can take their benefit early. They can take it as early as age 62. Now, if you're working off of your own number, again, it's the same kind of deal. It says 80% here PI. That's a rough estimate. If you're going off of your spouse's, it's going to be at 62 anyway. It's going to be about 37.5% is what you're going to get instead of the 50. So the 50 comes into play at your full Social Security age. Now, if you're divorced, but were married for at least 10 years and you're not remarried, then you do have the option of still choosing that 50% spousal benefit option of the Social Security. It does not affect your ex's benefit at all. In fact, your ex will never even know you're getting it. But it isn't because you were married for more than 10 years. That is an option available to you if that is greater than your benefit that you would receive off of your own earnings history. Now, I mentioned earlier that if you're taking Social Security before your full age, so let's say 62, 63, 64, for example, uh, then there's a limit on how much you're allowed to have in earned income. And so earned income does not count your pension check, but it does count going to work as like in the private sector or public sector or as a contractor, any of those things, right? So any job other than your one you're getting the pension check for, if you're being paid for active work, it's considered earned income. And that's the number that goes against this limit. So you're allowed to for 2024, that limit is $22,320. Now, if you go over that, under that number, you're fine. Your Social Security benefit will stay intact. Over that number, you'll lose $1 for every $2 you earn over that limit. They're going to reduce your benefit by $1. So you don't want to do, you don't want to turn Social Security on early if you're planning to continue to work because you're going to end up giving the benefit back, but you're going to handcuff yourself into that early benefit rate for the rest of your life. So if you plan on working, um, past that age, don't turn Social Security on until you hit at least your full Social Security age, which again, for most of you, is somewhere between 66 and 67. Once you hit that, you can then turn Social Security on and continue to work, and it won't reduce your benefit. And I mentioned earlier that you can delay it up to 70. Do not go past 70. They don't increase your benefit with 8% or anything like that after age 70. So at 70, you need to cut on Social Security. Even if you're going to keep working, cut on Social Security. So next thing we're going to talk about is the taxation of those Social Security benefits. Um, it's not cut and dry. And so there are kind of three different items that come into play. So the first thing they're going to do is they're going to take all of your adjusted gross income. This would count your pension checks, would it count military pension, does not count disability pension, military disability pension, but any taxable pension income is going to count. They're going to add to that any non-taxable interest that you have. And then lastly, they're going to take half of your Social Security benefit and add it into this calculation. Now, once they add it all together, if that number exceeds or is under $24,000, then your Social Security is not taxed at all. If it exceeds $24,000 as a single taxpayer or $36,000 as a joint filer, then Social Security is going to be taxed. And how far over that limit you are depends on the percentage of your benefit that is taxable. But it ranges between 50% of your benefit to as high as 85% of your benefit being treated as taxable income. I don't misunderstand, it's not 50% tax or 85% tax. It's just that's how much of Social Security will then fall as taxable income on your tax return. 15% of Social Security is always tax free. So most of you by now have heard that at some point in the future that Social Security is going to run into trouble. That year is 2034. So anything after 2034, if they do not make any changes to Social Security does have a funding issue. It is not as bad as some of you have heard. Um, Social Security won't completely go away. There is enough money in Social Security's trust fund to pay 76% of the projected benefit for every working individual currently. Now, 76% is certainly better than zero, but it's not full, right? And so my guess is they are not going to let this implode, that uh, hopefully within the next presidential window, they will have figured this out. There are already some proposals on the table, just none of them have gotten enough votes to be approved. But those votes typically include um, pushing the age, the full retirement age up. So right now it's 67. I've seen proposals where early age might turn to 65 and full age might go from 67 to 70. So that is certainly one thing they could do. They could also increase the taxes that you pay into Social Security, or increase the taxes assessed on Social Security. So there's a couple of different ways they can sort of uh, fix the problem, but and it may not be one. You may see two things done to sort of fix it. Not 100% sure. There are, like I said, several different proposals on the table, and it's being actively looked at. But I highly doubt that we get to 2034 without some sort of fix. So the next section here is FEHB and Medicare planning. So this is your health insurance, right? So federal employees are unique. When they turn 65 and retire, they do have to take Part A for Medicare, but they don't necessarily have to enroll in Part B. However, this is not a cut and dry, uh, situation where you should or shouldn't necessarily enroll. The reason I say that is that um, if let's say you are 65 and you're retired, it's important that both of these are in play, but you're no longer working, and you elect to not pay into Part B premiums. Well, what happens is for every year past 65 that you elect to not take Part B, there is a 10% penalty. So if you were to get, let's say, to age 70 and you never paid into Part B, you just stayed on FEHB, and all of a sudden the cost of FEHB has gotten kind of out of control, and you want to go on Medicare. Uh, well, Medicare is going to welcome you, but into Part B, but you're going to have to pay a 10% penalty for every year you delayed taking it. So in this example, 5 years. So that's a 50% penalty charge to the normal Part B premium, and you will pay that for the rest of your life. That is not a 1 year penalty; it's a lifetime penalty. So that's obviously not a good proposition. Um, what you elect here is definitely something I recommend talking with a financial planner about, a health insurance professional about. Talk to us about it, build it into your retirement plan. There are some decent solutions here. I have a lot of my clients that will elect to pay into Part B. The FEHB federal plan now has a what's called a Medicare Advantage option in it. So it's designed to work with Medicare Parts A and B, and that option tends to give you really good coverage while sort of um, minimizing uh, increases in costs that you may have on the health insurance annually. You're still going to get them; they're just not going to be potentially as wildly high. And let's sort of touch on some of this a little bit here. So Medicare comes into play again. You sign up for it. Really, if you're not on Social Security already, you're going to sign up for Medicare 3 months before your window opens, 3 months before you turn 65, the month of your birthday, and then 3 months after turning 65. So it's a 7 month window to sign up. And again, you need to take Part A. Everybody's got to do that. That's no cost to you. You sign up for Part A. Um, so, and again, you can wait longer, but every 12 months, it's a 10% increase on Part B, if you're not considered active employed. If you are working still and you're on FEHB, you don't get the penalty by waiting until you retire to then sign up for Part B. So Medicare was originally added to Social Security in 1965, and was designed for individuals age 65 and over, and it's four parts. So Part A is the hospital coverage. So that's the hospital insurance component. Think major medical expense, right? The Part B is medical insurance. That's like going to the doctor type stuff. Part C says here Medicare Advantage. It's actually Medicare Advantage, Medicare supplements, Medigap policies. All of those fall into Part C. And then Part D is prescription drug coverage. So that's A, B, C, and D. Now, Part A, I'll kind of walk through these again. You don't, premiums are not necessary because you did pay 1.45% in Medicare tax while you were working. Part A covers inpatient care in the hospital, care in skilled nursing facilities, um, hospice care, and home health care. I would caution on this one. Don't confuse this as long-term care. It is different. We'll touch on long-term care later, but that's not what they're referring to here. You elect Part A because you don't pay anything for it, but you do need to take it at 65. Part B. So this one's the one that has that monthly premium. And for 2024, the base monthly premium is 174.70 per month. This does adjust up a little bit each year as time goes on. And there are some things to keep in mind with that. 174.70, probably caught that I said that's the base premium. If your income level is above certain annual limits, then you may be subject to what's called IRMA, which is an additional charge to your Part B premium, and it does vary depending on how much money you make. So that's definitely something you might want to look into if you're, I would say if your income in retirement is projected to be over $100,000 a year, then you definitely want to look at taxable over $100,000 a year, then you definitely want to talk to somebody about how to strategize with IRMA against the IRMA taxation. Part B is going to cover uh, essentially your doctor's stuff: diagnosis, treatment of covered medical conditions, preventative services. Part B deductible for 2024 is $240 per year, and there is a 20% coinsurance after the deductible has been met. You may hear people refer to this as the donut hole of Medicare. It's that kind of window of money that's not covered by Part A or Part B. Part B does not cover, this is a big one, long-term care. Generally does not cover dental, eye exams, dentures, cosmetic surgery, acupuncture, hearing aids, or routine foot care. So these are things that you may need additional coverage for or pay out of pocket for. So I touched on this earlier. FEHB with or without Medicare. Again, FEHB, if you have Part B, FEHB can serve like the Part C. And I mentioned that FEHB actually has Medicare Advantage plans built into it now to help with that and get your premium that you pay each month for the FEHB down a little bit. So, but you can keep the regular FEHB as well, and they'll integrate with Part A and B. Um, uh, FEHB versus Medicare Part B. Again, you can keep both. You can also shop for more affordable Part C coverages, such as Medigap, Medicare Advantage, Medicare supplements. But you also need to make sure that you're covering the dental and vision. Medigap plans and Medicare supplement plans don't necessarily contain Part D for prescription drugs or dental or vision. So definitely want to look at that. Medicare Advantage plans, which I believe there's a slide on as well, they are required to cover prescription drugs, dental, and vision. So that is think of it as a bundled solution for you where it's all together. So this is kind of saying what I just said. So Medicare also includes things like drug, vision, dental. I even have seen where some of the Medicare Advantage plans include gym memberships in them. So they're very much a preventative care solution. And it does wrap all of those different insurance plans together for you. So Medicare Advantage plans, what's available to you? It's similar to health insurance plans. The best thing for you to do is to go to Medicare.gov. That is a very good site for you. It's a safe place to check this out. You can go in there and list your doctors, prescription drugs, all that stuff. And the options that are available to you are based on your zip code that you live in. So every zip code's a little different. When you go in, it'll ask for that stuff. You put all that in. And then it'll show you the plans available to you. It'll show you which ones work at your doctor's office, which ones cover all your prescriptions, it'll give you a good idea how much the premium is and what your max out of pockets look like. So it's very educational. As you get close to age 65, you will also get inundated with items in the mail, telephone calls, things like that from different health insurance agents trying to assist you in placing either Medicare Advantage or a Medicare Gap plan in place for you. So again, you're welcome to work with an agent on that. But if you want to kind of look at it without feeling any kind of pressure at all, Medicare.gov is a great place.